So welcome everyone. Thanks very much for joining the lunchtime webinar, Biking in a Post-Pandemic World, How Cities Are Transforming Their Streets to Get More People Cycling. I would like to encourage everyone to use the chat mode and to get comfortable with that. You can just hit that wee chat icon and say hello to us here. I'll start us off. But I'd certainly like you to get comfortable with that because we'd like for you to enter any questions that you have for the panelists today into the chat function. And we'll get to those questions once the presentations are finished. We are going to start very soon here. We got lots of people joining, so it's really wonderful. I'm glad we have such a wonderful turnout. Thanks everyone for joining us. If you could just turn off your video function, that can be a wee bit distracting, and it also helps with the bandwidth if everybody is not, or if everybody's got their video turned off. We are just about ready to begin. Maybe Kathy, you can let me know when you'd like to start, and we can dive right in. I certainly want to respect people's time, but I do know that we've got a few people here that are still joining, so we'll maybe wait a few minutes before we dive in. Yeah, wonderful to see so many people that are joining. I see we already have 50 people in joining us today. Thank you very much for joining us at our lunchtime webinar, Biking in a Post-Pandemic World, How Cities Are Transforming Their Streets to Get More People Biking. We're so lucky to have a wonderful group of panelists here to present to us today. Ralph Buehler, who is Professor and Chair of Urban Affairs and Planning in the School of Public and International Affairs at Virginia Tech's Research Center. Meghan Winters, who is Associate Professor of Health Sciences at SFU, and Lisa Leblanc, the Manager of Transportation at the City of New Westminster. I think we're just about ready to begin here, so let's do it. Welcome to the participants and everybody who's taking part in this. Really excited. Hub is really excited to present this to you today. I'm Gavin Davidson, and I've been involved in bicycle planning and advocacy in Metro Vancouver for over 3 decades. In the last several years, I've been helping Hub to build its planning practice, and thanks to the talented staff at Hub and the partnerships we have with public agencies, academics, and private industry, we've had the opportunity to be involved in a number of very exciting projects, such as New Westminster Streets for People, and you'll be hearing a wee bit more about that, I'm sure, from Lisa Leblanc today. We were also involved in a study examining policies and best practices to guide the growth of shared micro-mobility in Metro Vancouver. And that study was led by Meghan Winters from SFU's Cities Health and Active Transportation Research Lab, and she's one of our presenters today. And we were also involved and led, in fact, the State of Cycling in Metro Vancouver research, which examined Metro Vancouver's cycling network in relation to some key outcomes, including safety and ridership. And the State of Cycling recently won an award from the Planning Institute of British Columbia for excellence in research, so we're very proud of that. That study was a collaboration between Hub, TransLink, and local governments from throughout Metro Vancouver. And we had a lot of support as well, of course, from Hub Cycling's local committee members from throughout the region. So I'm very proud of the progress that we've made in a few short years, and there's more to come. In fact, in several weeks, we will be releasing an updated cycling map for Metro Vancouver that maps routes based on comfort rather than facility type. Our hope, of course, is that this map will get more people cycling more often and more safely, I hope, too. So this webinar is organized by Hub Cycling, and it's brought to you by Hub's card-carrying members. Hub Cycling is Metro Vancouver's advocacy group for people on bikes, and our mission is to get more people cycling more often, achieving this goal through action, events, and research. You can find more information about Hub's work, membership, and events at bikehub.ca. We'd also like to take the time now to acknowledge that we are webcasting live from the traditional territories of 3 local First Nations, the Musqueam, Squamish, and Tsleil-Waututh. A special thank you to our members for making this programming possible. And if you'd like to join Hub, please visit bikehub.ca/join. Just a few housekeeping rules before we dive in. As you listen to the presentation, please use the chat function to ask questions. We'll give our speakers time at the end of the presentations to answer those questions. Moderators are standing by and will remove anyone who's being disruptive to the webinar. Just a reminder, a friendly reminder. And also the meeting and all the chat messages will be recorded and or live streamed. So please don't record or photograph the meeting, and don't share sensitive or personal information in the chat. We also want to let you know that we have an additional bonus for you today. We will be raffling off the recently published book by one of our presenters, Ralph Buehler, the book that he and his colleague John Pucher have published is called Cycling for Sustainable Cities. There it is on the screen, and you'll have to stay to the end of the webinar to be entered into the draw, and we will contact the lucky winner tomorrow. If you are not a lucky winner, the book is available now in paperback, so you can get your own copy regardless. So let's get started. We have great presentations for you today by 3 very distinguished and knowledgeable panelists. Dr. Ralph Buehler is a professor and chair of urban affairs and planning at the School of Public and International Affairs at Virginia Tech. And he's a recent co-editor of the book, Cycling for Sustainable Cities. Dr. Meghan Winters is Associate Professor of Health Sciences at Simon Fraser University, and Dr. Winters examines the links between health, transportation, and city design. Lisa Leblanc is the Manager of Transportation for the City of New Westminster, where she leads a team of professionals in delivering the city's bold vision for accessible and sustainable transportation. We're so lucky to welcome these great panelists. Please put any questions that you have for the panelists in the chat section, and I'll draw upon those questions for the speakers at the end of the 3 presentations. So now I will turn it over to Ralph. Thank you.
Thank you very much for the introduction. Thanks to everyone for joining. My presentation today is titled Cycling During the COVID Pandemic, Initial Trends from the USA and Western Europe. And I'll talk about these cycling trends during the pandemic in 3 different ways. First, I'll talk about the trends in cycling levels. Second, I'll talk about the trends in measures implemented to get more people cycling. And then I'll venture into a short outlook for the future past COVID. At the bottom there, you see a big list of all the people who helped me put this presentation together to get data from different countries, different viewpoints, different organizations, and different places. I want to emphasize here that these are preliminary findings because, as you'll see, the cycling trends during COVID vary. And we'll have to see where all of this is going. First, this is data from a company called Ecocounter, international data. They are counting bicyclists going by counters that are installed, and you see the trend throughout the year 2020 compared to 2019. Whenever the lines are above the zero, that's here in the center, we have more cycling than in the year before. And you see for a good share of 2020, and especially in the latter months here, we are clearly above the zero line from before. You also see a big dip here. This is when many countries, especially in Europe, had lockdowns. And you also see quite some variability. So there are some countries that didn't do that well. This graph is looking at the eco-counter data just for the United States. In green, you see a 4-year moving average of people counted at these counters. So the line is less erratic than the blue line. Again, the same idea. If we're above the zero, we have more cyclists counted in 2020 compared to 2019. And you see for almost all the months, we are above that level. Yet another data source for that is from Rails to Trails Conservancy. They have counters along rail trails, counting cyclists and pedestrians. We see the counts for 2019 in blue and the counts for 2020 in red. And we see that the red bar is much higher or higher than the blue bar. So we had more people counted at the counters on these rail trails in the United States, in particular, a high share here in March. The trends, as I said before, vary. They vary by city and they vary by time of year. The first trend here, that's counters close to downtown in New York City. Again, the red is 2020, the blue is 2019. And we see that initially cycling was sort of down, especially in April, but still in May. But then since June, cycling in 2020 was higher than cycling had been in 2019. Another example showing a different trend is Washington, D.C., where we have, with the exception of November, since the pandemic, we have not fully reached, at least in the downtown location, the 2019 cycling levels. This meshes very nicely with app-based data from a company called Streetlight. They have done a report looking at cycling levels in different US cities and metro areas. All metro areas that are highlighted in blue or dark blue have seen cycling increases, July 2020 compared to July 2019. The ones in the yellow color have seen decreases, and what we just saw was Washington, D.C. So Washington, D.C. also with the Streetlight data is yellow. What Streetlight found, though, is they found massive increases in cycling in places that are not known for their high cycling levels or for their cycling. What can also be seen from the Streetlight data is that there are trends in the increase in ridership over time. So in May 2020 compared to May 2019, we have some dark blue areas here, yet darker blue, all increases in cycling, and then some areas that reduce their cycling. By July, we see that the blue is a little bit less dark, probably also because we have generally higher cycling levels in the summer, but the trend is not as strong towards cycling. We also see some places that have flipped, that went from net losses to increases, like New York City here, what we saw before. But all in all, the data sort of meshes together from two different data sources, and that's nice for a researcher to know that they actually fit. Jumping across the Atlantic to Europe, these are trends, again, 2020 in red, 2019 in blue for Barcelona, Hamburg, Basel, and Oslo. And we see in almost all of these cities quite a healthy increase in cycling in 2020 compared to 2019 based on these counters from EcoCounter. One of the countries that stands out in its cycling increase is France. They have seen a 30% increase after their lockdown in 2020 compared to the year 2019. In particular, Paris is high, but also cities such as Lille. And what happened in France is quite indicative, but also interesting. In transport, normally in bicycling, we have a distribution of bike trips during the day as seen in the blue line here. So we have a peak in the morning around 7 to 9 o'clock. That's people biking to work. And then we have another peak, we call it in the afternoon, and people come back from work. With COVID now, however, the morning peak has disappeared. Many people are working from home, so we don't see that big bump of people going to work in the morning, but we have a large afternoon bump and people go out and ride bikes. Also can be seen nicely in the French data is the impact of a very severe lockdown. This is the trend of bicycling 2020 compared to 2019. We're sort of around a little bit higher than the 2019 levels. And then in March, there comes the lockdown, and people were only allowed to go out for certain purposes. They were not allowed to go that far from their home, and cycling really plummeted. And once the lockdown is lifted here, cycling skyrockets in rural, suburban, urban areas and in the country as a whole. Another data source looking at COVID and cycling is bike sales. That's for the United States. So the period from December 2019 to November 2020, spending on bicycles, accessories, parts, and shop services across the US was up 53% compared to the 12 months before. And bike sales increased by 39% in units and 69% in dollars. So a healthy increase in bike sales. And at the bottom there, you can see what bikes increased the most in sale. E-bikes is the one that stands out here with 190% increase, likely from a lower level than the others. There's a survey that I found for Germany asking, during COVID, how did you change your travel behavior and which mode did you switch from to another? And the upper left here shows those who said they were driving before mainly, and the biggest barrier is no change, but there are some people who switched from driving to riding more bikes and some to more walking. The upper right, you see public transport. Very few people said no change, and big changes towards other modes, including bicycles. The lower left is from walking. Most people said they didn't change their walking. Some switched to bicycling, some switched to driving. And the lower right is from bicycling. 70% said there was no change. Some switched to walking and some switched to the car. There's some movement between the modes going on. We see something similar for the United States. This is for Portland, Oregon and Nashville, Tennessee, asking people, transit riders, how their mode usage for other modes has changed, and 25% stated that they replace transit trips with bike trips at least sometimes. Now, what are the measures implemented by different cities? We have slow streets, open streets, shared streets, street and intersection closures, and automated pedestrian signals, but also pop-up bike lanes. This is in Sevilla, Spain, where they didn't build any new infrastructure, but the old infrastructure that was in place is just used very well. This is Paris, the Rue de Rivoli, which was just finished, the cycle track, right before the pandemic, and now sees fantastic amounts of bike traffic. This is a new COVID bike lane they put in between Neuilly and La Défense. You see the big arc back there. During the lockdown, nobody was driving, and they just cordoned off that part of the street for bicycles. These are pop-up bike lanes in Berlin, Germany, where they just put in the yellow color and gave cyclists additional space. Most common here in the US are slow streets, where neighborhood streets are closed to through traffic, and pedestrian, cyclists, and runners can use that space more safely. We also have seen a lot of parking areas being transformed into outdoor eating areas, or even entire blocks of commercial streets being cordoned off to become sort of pedestrian zones. Some cities have tried to develop guidelines for these new pop-up bike lanes. This is one from Berlin, Germany. The European Cyclist Federation tracks investment in bike infrastructure since COVID, and this shows you how the countries announced and then implemented new bike infrastructure per million population, and because it's per million population, it tilts towards the smaller countries. But also overall, they find increased bike expenditures for various European countries per inhabitant since the pandemic started. I found one study that looks at how these programs worked. On the left here, you see all the European cities that implemented new pop-up bike lanes. And then the authors tried to relate it to changes in cycling level. And they found that on average, these bike lane programs increased ridership 7% citywide. Last, as an outlook, so in general, there's a positive trend for cycling and bicycle sales, but the impacts vary by geography, that's city and country, by season, also by COVID policy, especially lockdowns, and by time of day. The role of the decline in public transport and the shift to cycling is still unclear. We know there is a shift, but we don't know how large it is. And after COVID, we'll likely have more working from home. We'll also have many people who are now exposed to cycling as new groups that hadn't cycled before, and we don't know if it's going to stick. we can make some of this new infrastructure that was built permanent, or the new speed limits permanent. And the crucial importance during COVID and after COVID is the safety and the convenience of cycling. And now I'm over 1 minute, and I yield my time, and then we can discuss later. Thank you very much for your attention.
Thank you very much, Ralph. I guess next up is Meghan Winters.
There we go. Hi, is it working now?
Well
We're
done.
Good. Okay.
Hi, Meghan.
The screens are changing as they do, so here we go. You probably can't see me either, but we'll go with that. So I'm going to bring this into, there I am. I'm going to bring this into the Canadian stories now, and I had the benefit of seeing an early version of Ralph, so I tried to color code it so that you can get a cohesive story as we go. I want to highlight that early on through the pandemic, people were all of a sudden desperate for mobility data, which is something we don't have good data on. And one of the main things people were relying on, this is governments, agencies and the like, was sort of data from Apple and mobility trends. And so this is the data from Canada and then for the city of Vancouver that shows, you know, this is in terms of people who use Apple, the mobility app in order to find routing directions. And so it's a proxy completely. And I want to say, of course, that it had no cycling data in it. So people kept asking me, what do we know about cycling? And where's the cycling data? And we had to go to different kinds of sources to dig deeper. So, you know, my group has looked at the automated cycling counter. I'm going to focus Vancouver and some other Canadian cities, but this is a chart that would look like what Ralph has shown you for many US cities. And so this is what the data looks like for the 19 automated counter stations in Vancouver, across Vancouver. I don't, you know, my view on this, you see 2019 and 2020, is that we don't see that kind of, on average, dramatic trends. I think many people have reflected experientially that they feel it and they see it, and in certain locations they see it. And it's often been highlighted to me that also, well, we're out at different times of the day now. And certainly at some times of the day, there's probably peaks. So here, like on average, I would say there's some months where we've been a little bit higher, but not the kind of dramatic changes that we've seen in some cities. But when we look at different stations, and so I just picked 3 of them here that tell you different stories. These maps are percent change, so that would be year on year, the kind of thing that Ralph was showing you. And if we look at this Point Grey and Stevens location, it's a place where we see that actually there have been dramatic increases in the number of cyclists going by that station. If we look at Burrard and Cornwall, we see that post-COVID that things were sort of, you know, on par, not a lot of change or not consistent change in one direction. And then a location like the Dunsmuir Viaduct where we've seen declines in cycling. So I think the answer is, has cycling increased? Depends very much on where you are, even on the spatial scale of a city. We looked at sort of for other kinds of data. One of the other kinds of data we can track is the public bike share data. So this is their trip data. And I included the extra years on here because I thought it was nice to see that there has been consistent growth year over year. So if you go from the gray to the yellow to the blue, but when we get to the red, we see that certainly bike share levels and usage were dramatically affected. And we do see that kind of a large decline, in fact, in the number of people who are using bike share. A lot of other questions that came up for me have come up over this time that there aren't data sources on, is people see more they see more micromobility users, more e-bike users, and bike sales data in Canada. I'm glad that Ralph and I read the same hot off the press recent publications, and so I've been looking for bike sales data forever. It's interesting to me that you see this one from the US, and I think it's a good and valid source that highlights e-bikes, and I think these kinds of trends probably hold in Canada. But sort of building on that, and my group are interested in the changes that cities make and what benefits they might have. So I want to say that, you know, transportation systems have a role in making sustainable, resilient, and equitable cities. This is something that was highlighted early on. So in May in 2020, many leaders signed on to this 2020 Declaration for Resilience in Canadian Cities. It had tangible actions that cities should be taking sort of in this moment in order to sort of reset and make more equitable options and travel patterns within cities. So if you're not familiar with it, I think it was a good high-level statement as to actions that were happening. And then watching how those showed up down sort of on the ground and seeing our cities take action, and they might have been doing that for very different purposes. So some were acting for mobility reasons, it was about public space, and some was about the economy. And in these different phases of response, recovery, and moving into resilience, I don't have timelines on these because I have no idea what the timelines of our future look like these days. So these are sort of tweets that came out early from Vancouver in their commitment, from Toronto, suddenly enacting major changes that people have been waiting for and building towards for decades. As well as, Ralph mentioned there were guides. This is a guide that came out from the Federation of Community Municipalities that I think has really great examples from diverse and different types of communities as to their immediate kinds of actions they could take. These things will always be relevant at the snapshot in time that they were created, and there's a longer storyline that we're living and evolving in right now. So just to highlight, I'm going to focus on Vancouver because I knew Lisa was coming for New West. And I knew that many of you were in Vancouver. So I'm sure we're aware and familiar with Vancouver's Slow Streets network that has come out sort of starting through the summertime, and that continues to have upgrades towards the program. It's interesting to think about which communities these rolled out in and what they sort of look like on the ground and what the reactions and motivations were. The city has done some surveying, and probably like I did, many of you have contributed to it. When I spoke with them last week, they said the results of these slow street surveys would be out in spring 2021, but there are some snapshots from presentations and reports out to council. I think it's, I just picked this one slide that most people would like to see more, that they felt that they could be improved, that they could have barriers and permanency. And that certainly there was perspectives from diversity of road users that it may have actually hindered their mobility and hindered some people's ability to get to where they need to go. The quotes here highlight things about the geographies, more in South Vancouver, especially in areas where children and young and seniors live, that it's been great and it should have been done long ago, and that while it's great conceptually, the barriers that were there in place may not be reducing traffic or reducing speed limits. So I think they've had these suggestions going forward, and if you're on their website, there are plans as to how this is going to roll out and go forward. Now, I think I put this in the chat, so there's a link here which isn't going to work really well in our live presentation right now, but I wasn't only interested in Vancouver. We looked at 3 mid-sized cities across Canada and have published on this work. It's just coming out right now. Victoria, Kelowna, and Halifax. And what I have posted in the chat and will repost is an interactive story map. So there's a whole summary of our results there, as well as maps that you can sort of highlight. In these, we're interested in how are cities designing their street reallocation. So cities were acting fast, they were just responding. And there was different reasons and rationales across cities. And which neighborhoods are the street reallocations happening? So which neighborhoods, which people are benefiting or have exposure to these kinds of street reallocations? What communities are they going in and why? And we see very different stories across the cities that we looked in. So maybe on the whole, I can tell you that Halifax sort of had the largest relative scale. So they built out 20% of their street network, or 20% of their active transportation network in terms of street reallocation. So they quickly rolled out a large area. In Kelowna, they closed down just one city street downtown. And in Victoria, somewhere in the middle of those, and then the rationales and reasons behind them. So I encourage you to play around on this, and I know our slides will be shared in a PDF. This is just a beta version, pretty much out this morning, to summarize the research that we have coming out. The key takeaways sort of from looking across these cities is that cities that had active transportation plans, strong ones in place, had more capacity to act. So some of them were rapidly positioned. Essentially, they just rolled out what their next plan was in sort of a lighter, quicker, cheaper way than they might have intended it to be. When we look at which neighborhoods benefited or had street reallocations, in this early phase, cities were focused on areas that had high populations and high activity levels, but they might not have been thinking or spending time allocating or making these street reallocations in areas that might need them. That could have been lower income settings. It could have been places with children and seniors. And we saw that quote going forward. So as we're moving forward into considering what new additions should be made or where we should make these more permanent, we may be moving forward with a more equity focused approach to connect population groups to their everyday destinations. A key point that evaluation is essential, but data is really lacking. And this is no critique to the cities at hand. They were moving as fast as they can. And often, you know, these weren't in places where they would have had baseline data to be able to show the kinds of change that we need. We can learn from these early action pilots, but we do need more data on the usage patterns that we see, who's using it, the safety benefits. There's still certainly complaints about traffic volumes and speeds along them. And community consultation on the equity impacts of these actions. So whether they're benefiting or hindering, and what the sort of different groups of people might feel about the utility of these. Just to close, like early on in the pandemic, Anthony Pearl, who's in urban studies at SFU, gave a talk that I just thought was really interesting about where is this all going to head. And, you know, the two questions that he left on the end is like, ultimately the impacts of this depends on, you know, he gave this presentation in May. Okay, so now here we are many months later. How long is the interruption? So how long are we in this phase of disrupted behavior? And I think we would all agree it's gone on possibly longer than we might have thought it would. And how deep is this disruption? So how long these impacts will go, whether people will keep cycling, whether public transit will recover, you know, sort of has this factor as to how deep the problem is and how extended this period is. But we're already sort of, you know, seeing shifts and rapid shifts, and certainly at the time that he was giving this talk in May, there was many more questions about the future of transit than there might be today, or the security of transit. So I want to thank Jamie Fisher, who's really the lead on the story maps that I'll share with you again. Geneva Bristow, who has done a lot of the year-on-year data analysis here, and Cashlin First, who works with me on the Slow Streets project in Vancouver. Thank you very much.
Thanks very much, Megan. A wonderful presentation, and thanks everyone for all the comments and a few of the questions that we're seeing in the chat window there. Please keep that up. I'd like to now turn it over to Lisa Leblanc from New Westminster. Hey, Lisa.
Thanks, Gavin, and welcome everybody. I'm pleased to be here to tell you about how the City of New Westminster responded at the start of the pandemic and how we're continuing to respond. For those of you not familiar with the City of New Westminster, we're a small city. We have a population of about 70,000 people. We're small geographically as well. We're about 15 kilometers squared. So there's not a lot of area. We're very dense, very densely populated, and we're hilly. So we have a number of interesting sort of baseline conditions here in New West. The other characteristics that we have though, we have limited resources. We have a small tax base. Infrastructure costs the same to implement in a small city as it does to implement in a big city, but we have fewer people to spread the cost over. So it's something that we're constantly keeping in mind. How do we most efficiently do things? The other characteristic, and if you could advance the slide, please, Kathy. The other characteristic we've got is really strong policy and very strong political support for sustainable transportation. Everything from our very high level policy in the official community plan and the master transportation plan, all the way through to our most recent policy direction, really supports sustainable transportation. And it's not lip service in New West, it's very direct, explicit support. So when our current mayor and council were elected, soon after they were elected, they created a strategic plan for their term of council and identified 7 key priority areas. Sustainable transportation was one of those priority areas. And then shortly after that, they declared a climate emergency and requested that staff reformulate or frame the budget around our climate emergency response. So out of that came a reconfigured budget around 7 bold steps for climate action, which were unveiled, if you will, in the fall of 2019. If you could advance the slide, please. 2 of those 7 bold steps explicitly address sustainable transportation and a shift in not just mode of travel, but also in how our public realm configured. So the first bold step that relates to sustainable transportation is a simple acceleration of our master transportation plan targets for mode split. So we're aiming to have 60% of all trips within New Westminster to be by sustainable modes of transportation by 2030. We're well on our way to achieving this goal. We're at about 50% right now. The second goal, or the second bold step of significance, though, is something that we did because we knew that it was that we needed an additional incentive to make big, bold changes here. We're a fully built-out city. Making change to support sustainable transportation is challenging. There's no new streets happening here. We're taking existing streets, many of them very narrow, fully built out, and we're having to convert them into other uses in support of climate action and support of sustainable transportation. So we knew that there would be dramatic changes that would have to happen. So we adopted bold step 7, which is to reallocate a minimum of 10% of today's street space that only serves motor vehicles to serve sustainable transportation, public gatherings. So it's not only about transportation, it's also about public realm and the experience in the public realm, and greening. So reallocating road space for green infrastructure, for example, for tree planting, or for other things that work in support of sustainability. Next slide, please. So that was our policy, that was our foundation going into the pandemic. We already had strong policy. What happened soon after the pandemic was declared and the state of emergency was declared is that Councillor Patrick Johnstone advanced a motion for council's consideration. This happened in early May. And the motion basically put all of our existing policy on steroids, and they said, and it empowered a subcommittee of council to direct staff, and it empowered staff to move very quickly and aggressively on road space reallocation. Explicit support for doing things quickly, but also doing things boldly and doing things admittedly with minimal public engagement. Just act and then ask people how we can make it better. And doing things with temporary materials on the assumption that we were going to turn those temporary things into something permanent eventually. Next slide, please. So what we did initially within the first 2 months after the pandemic was declared, and in fact, even before Councillor Johnstone's motion hit the floor of council, we went out and did a number of things throughout the city. What we did was intended to make it safer, more comfortable, more convenient for people to walk and to enable them to have safe space to move. So we reallocated a bunch of curb space in our uptown area to provide people with more room to walk. It also served the purpose of supporting cyclists as well, because all of that space that we created is available for cyclists to use as well. We also made some signage improvements in certain areas of the network, and we closed a couple of lanes of traffic. And I'm sorry, I realize now that when I made this slide, there's a box there that shouldn't have appeared. It covers two of the things that we did, but we took a lane of traffic back for walking over the McInnes overpass. So getting out of the Quayside neighborhood now, you have a lot more space to walk, and it restricts motor vehicle traffic out of the Quayside neighborhood to the other two points of access and egress. The other thing under this yellow box is that we closed Front Street, or I should say we opened Front Street to walking and cycling during every weekend throughout the summer. So Front Street is a truck route, noisy, stinky place on most days, and we closed it to all motor vehicle traffic 8 to 8, Saturday and Sunday and holidays throughout the summer, and invited people to connect along the riverfront between our two parks on the riverfront. And it ended up being really well used and really well enjoyed. The other thing that we did is up in the upper right corner of this image, labeled number 2, is the Central Valley Greenway. So we took a lane of traffic away from East Columbia Street southbound and reallocated that for walking and cycling. The Central Valley Greenway in this location, that connection is just a narrow sidewalk that cyclists and pedestrians are meant to share. That didn't feel good, especially as we were seeing more and more people walk and bike. So we took that lane of traffic. That road space reallocation remains in place, and we're working to make it permanent. Next slide, please. So these are some images of what we did. The McKinnis overpass is in the upper left. We had a bit of fun with signage, I'm not going to lie. So we borrowed words from Dr. Bonnie Henry because those words were out in the public domain already, and we thought they were good words to remind people about. So on one of the overpasses going into the Quayside neighborhood, we reminded motorists in particular that we just all need to calm down a little bit. In the lower right is the Central Valley Greenway lane reallocation for walking and cycling, and then in the lower left is the Front Street open weekends. And you can see the W just off to the left. As you know, the Westminster Pier Park, that section of the park burned. So this summer, provided people with an opportunity to experience a piece of the riverfront that actually no longer exists. So we're very pleased to have done it and left that memory for people. All right, next slide, please. So we have continued. So it wasn't just the first few months of the pandemic where we had a flurry of activity. We created a list and shared that with council, and they committed to supporting us and continuing to pursue projects throughout the summer and fall. So we've added a bunch of things, which I'll talk about more later on in the presentation, but we added a bunch of sharrows throughout the city and signage and wayfinding to help people get around by bicycle, but also to remind motorists to expect to see more cyclists on these routes throughout the city. We did a number of additional interventions on various streets downtown, and then we've advanced design on some other things that were just a little bit too tricky to do really quickly with the resources that we had available. The biggest thing that we've advanced here is item number 5, which is the interim greenway. We committed to building a greenway over the winter and to use that as an engagement tool. Get people out there experiencing it, tell us what's working, how we can make it better. That is part of the engagement for the Agnes Greenway. It's our intention to complete that engagement later in the spring and to actually begin construction of the permanent greenway later this year. And I'll show you some images of that in a minute in the presentation. Next slide, please. There's still some other things that we're continuing to work on that are just bigger than what we have capacity for right now, including some greenway planning in the uptown, including some spot improvements to an existing crosstown greenway, which is item number 3 across the city. And we're tying that all into planning work that we already had underway. So it amounts to advancing plans that we already had in the books that we were going to be getting to in the next 5 to 10 years. I would say there's probably between 4 and 6 projects that have been accelerated in a big way as a result of the pandemic and the response that we've had to the work that we've done in the last 6 to 8 months. Next slide, please. So we felt very strongly from the get-go that there is more to supporting people with cycling and walking than there is than infrastructure. Infrastructure is important and foundational, but it's only one piece of a bigger equation. We are a very engaging city. We like to hear what people have to say. We don't necessarily ask permission for what we do, but we definitely ask people how we can do it better. So it was really important to us that we talk to people, that we encourage people to get out and experience these things that we've done. It was important to us that we do some monitoring and document the outcomes. And as we embarked on this with a couple of important partners, the importance of checking in with people about what the well-being impacts were became really important to us to understand. So in order to do this, we engaged in a partnership with Happy City and Hub Cycling. I think we signed the contract documents in July, and by mid to late August, Hub Cycling and Happy City were out on the street talking to people, activating all of these interventions that we'd done, counting people, paying attention to who was in the public realm, but also who wasn't showing up. Were these things serving a broad spectrum of our society, or were they just serving the people that are already out there and able to experience the public realm? And then they also talked to hundreds of people about what their experience was in these retrofitted environments, and compared that to people's experience in the non-retrofitted environments. I'm not going to get into the details of Happy City's well-being assessments or the outcome of this. I wanted to focus mostly on infrastructure today, but just to alert you that there is a fantastic report that was presented to Council in December, on December 14th, and I'll share the link to that report where you can read about all of the research that Happy City did and the findings from the well-being assessments in particular. In short, what the well-being assessments concluded is that the reallocated space served people well. People were happier there, they were more connected, they were off their phones. We saw seniors and people with disabilities, we saw a broad spectrum of socioeconomic representation. So we were really pleased with the outcome. We felt like it was a good step towards what we're trying to achieve in terms of equity. Next slide, please. So this is just a picture of some of the activations and the work that volunteers and staff from Happy City and Hub Cycling and the city undertook under the banner of Streets for People in 2020. Next, please. So back to the Agnes Greenway. So part of our pandemic response was to accelerate this long planned for Greenway route across the downtown part of the city. Next slide, please. And Kathy, you can just cycle through these, just rest on them for a couple of, maybe a few seconds each. We built a greenway in December. It took us about 2 weeks to lay down all of the pavement markings and all of the barriers. We put down temporary asphalt ramps. We built a bus bulge in order to enable buses to stop in lane and bicycles to have a separated facility. We installed a temporary special crosswalk to support crossing 6th Street at Agnes. Did that, all of the infrastructure, most of the infrastructure I should say, was in place within a couple of weeks over December. We've had a few things that we need to tweak still, so we only just opened the Greenway earlier this week. It's available for use to get you across downtown, and it's our engagement tool. We're using the interim treatment as a way to engage with people, have them experience the Greenway, tell us what their experience is, and help us to design the final Greenway to the best that we can based on people's direct experience. And that's it for my presentation. I'm very happy to take questions.
Lisa, that was hugely impressive and quite inspiring to see all of the wonderful work that has been done in New Westminster. Congratulations, and keep it up, please. So Ralph and Meghan, thanks to you too. Some excellent presentations there. There's been some good chat here while the presentations were going on, and I'll get to those in a second. For me, it's extraordinary to see how transportation patterns have shifted so dramatically in response to the pandemic. And what I gather from the data is that we're seeing a significant reduction in traditional commuting patterns, but that people are continuing to travel to meet their daily needs and to stay healthy. I've been really impressed by not only the rapid response that we've seen from New Westminster, but from a number of agencies throughout Metro Vancouver. We've seen bus-only lanes pop up throughout the region. We've seen curbside parking replaced with seating and space for queuing. And we've seen motor vehicle traffic calmed and reduced on local streets in order to make space for public gathering and more active transportation. And even some major streets where some space is being carved out for active transportation. And that's wonderful to see. And I guess my question here is if we continue to be threatened by this pandemic and possibly others, what future changes can we anticipate? And so maybe, Lisa, I'll throw that first to you since you're in the thick of things.
Thanks, Gavin. I think that's a really interesting question. We are proceeding at this point based on our current reality. So we are assuming that this is going to be our new normal for another couple of years. We've got very strong support to continue proceeding with the things that we'd identified. We have really good neighborhood level plans that enable us to just keep chipping away, and we've got a budgeting framework that gives us an opportunity to work within our priorities and to allocate financial resources based on what council says is really important. So from my perspective, I don't see the pandemic going, or the impacts of the pandemic going away anytime soon. I don't see any reason for us to slow down. Having said that, we can only go as fast as we can go. We've only got a limited number of resources, and we have to kind of balance that and take care of each other and ourselves and do what we can do at a measured pace. So from our perspective, we're carrying on.
Wonderful. Okay, so Ralph, Meghan.
I can say something. I think it ties into a question that was in the chat here. I think one of the big questions is these were quick and temporary changes that we saw in some cities, and looking across Canada, certainly some of the more winter cities have taken down sort of street reallocations that had happened in Metro Vancouver. We want to see these moving, and people are bound to be, if this pattern remains for longer, there's still less commuting, there's less activity downtown. And so people are encouraged to stay local in their communities. So there's many communities that haven't been well served, areas that might have higher levels of traffic, less safe streets to be on, and be desperately in need of infrastructure. And I think that some of that resonates with what we know of Vancouver when we see it on the map there. So it's a question of, now we have a little bit of time to breathe. Do we know how well these are working? Do we know, I think the feedback has been that some of them certainly need more permanent interfaces and more traffic volume, more reductions to traffic volume. So I think that's what we're watching going forward.
Yeah, and I think implementing these measures or making them more permanent is also a way to make our cities more resilient for future shocks. So even if this shock is over or goes away to some extent, others may come or can come. They can be the same as a virus, but they can also be different. And having these transport alternatives and these viable alternatives for people to be outside are going to be important to make our communities more resilient. The story I heard in Paris, France is the same what Lisa talked about. They said they achieved in 5 to 10 years, in a short period, what they thought they would achieve in 5 to 10 years. So I think we made big leaps, and many people got the option to move by bike or move on foot and experience what it's like. And if they had a good experience, it will stick. For me, the big unknown is public transport. And I feel very sorry for public transport and the declines they have seen, because people are not comfortable riding public transport. And I hope people will go back to public transport and combine their experience walking, cycling with public transport as the pandemic is easing.
Yeah, that's a really good point. Thank you very much, Ralph, and thank you, Meghan, too. I'll go back to a point that Kay raised in the chat. She says, it's interesting that the change in biking in Vancouver has been reductions in the downtown office areas and increases in the outlying, more residential areas of the city. And she makes the point that it makes the lack of expenditure in residential areas on infrastructure and bike share more problematic, because we're unable to take as much advantage in the change in demand as would otherwise be possible. Do you agree with that statement, Lisa? And is that true for your jurisdiction as well?
Yeah, it's an interesting observation, and I would say, I mean, it's hard to say with New West because we're so compact, and we don't have this. We're kind of like the whole city of New Westminster is kind of like the metro core of Vancouver, where we've got a concentration of density. We have very small, purely single-family home residential, but they're right up next to communities that are more dense, that are more multifamily oriented or mixed use. So it's a little bit hard for us to compare to some of the other cities that have much larger swaths of residential. Having said that, I'm going to answer the question slightly differently, because there's another interesting kind of thing that we've had to think about differently. So there's an equity lens that we've applied to things, I would say differently and better than we have in the past. What we've learned through this is that the relative impact to really vulnerable populations like seniors and people with disabilities is significant. There's a much bigger relative impact to certain groups as a result of the pandemic, but also as a result of some of these road space reallocations. Changes to transit disproportionately impact seniors and people with disabilities. A small change for an able-bodied person to go around the corner or up a hill to catch the bus in a different location is a much bigger impact to a senior or a person with disabilities. So what we're finding is that much of our response, for example, to the Agnes Greenway, since we've put the temporary measures in, much of our response skews to people with disabilities and seniors. We know that we can't do things the way we did before because the relative impact is greater. So it has forced us to look differently at who's benefiting from and being impacted by things.
That makes a great deal of sense. Interesting to look at it from that perspective. And this next question is to Meghan, and it's from Erin Omel, and she's wondering, how would you ideally and realistically identify neighborhoods most in need of active transportation improvements and street reallocation?
Yeah, and that builds nicely on what Lisa said. So primarily, the planners in those cities know, and through the course of events of 2020 are really thinking differently about which populations might be most in need within them. The link that I sent with to the website has, way down at the bottom, has some interactive maps that really just overlay census data according to where interventions have happened. Right now, they're just for Victoria, Halifax, and Kelowna, but what that is meant to do is, there's a bunch of buttons you can overlay there, and those may be populations that are of particular interest to you. In general, because we've seen changes happen in more urban areas, because they're coupled with needing, more space for walking and more space for where there's population density, it hasn't been space where there's kids. And so, and in New West. And so I think it's interesting to look at, where the seniors are, if that's the population that you're looking at. I will say we don't have good data on people with disabilities at that census level, and so you won't see that on my slides, and that's take home from something I will add to the story map after today's conversation. Maybe a story I would just highlight here that's a Vancouver example is I also lead research studies along the Agnes Greenway, which we know goes through some of the higher income areas of our city, but is a great connecting route, and the volumes on the Agnes Greenway have continued to be very high and growing. But now people are particularly heightened concerned again about there not being enough space. And that's the pedestrians want enough space. People walking want enough space to be more separated. And that puts that additional squeeze that was already felt along many areas of the Greenway in terms of navigating people walking and people cycling in that space. So, what was only borderline wide enough to start with is now really not wide enough because people are thinking they need much more space to spread out. The other thing I would highlight along there is because of COVID, they had to remove a number of the bathrooms, public bathrooms that were available there, and the stores and sort of shops that people would use also aren't open. And so when we think about the needs of different population groups and users, we really need to find ways to ensure that there are bathrooms along these corridors that people can use. It may not be the sexiest topic, but I think it's one that needs to just be continually raised.
If I may chime in here quickly, I think we should also not forget the people who cannot work from home and who have to go to work still. And there could also be a way to identify routes or infrastructures that are needed. I'm very fortunate. I've been working from home since last March, but there are people who go to work and have to go to work. And we see that in public transport. Here in the DC area where I'm located, rail ridership is way down. Many rail riders are wealthier and they can work from home now. Bus ridership is not down as much because people have to go to work. They often work in jobs that cannot be done from the desk at home. And so we have people who still have to go places, and there could be another way to approach to figure out where we have to put infrastructure, we have to put things to facilitate movement of individuals who are not as fortunate as those who can work from home.
And I'm going to add to that as well. I mean, again, back to seniors and people with disabilities and limited options. So there are a lot of people that have no choice but to use transit, either because they can't afford it or because the other available options aren't accessible to them. And it really highlights inequity issues in what you otherwise would expect to be a pretty accessible place. So it's been very interesting for us how that's been highlighted and what we've learned through the pandemic.
Thank you very much, Ralph, Megan, and Lisa. A really wonderful conversation here, and I think it's very fitting that we should end on the question of equity. I think it's a very important consideration, and it's something that we've begun to discuss quite regularly in our staff meetings at Hub Cycling. Again, a big thank you to all of you and to Hub members who made this webinar possible. If you would like more ways in Hub, you can join Hub as a member for as little as $15 a year and help make cycling safer and better for everyone across Metro Vancouver. You can also check out our many cycling education courses. You can volunteer at a Hub local committee in your neighborhood, and you can check out other events, both online and in person, that will be happening this year. Visit www.bikehub.ca for more information. We're at the end of the webinar. Our facilitators will leave the meeting open for a few minutes longer for those who want to leave comments in the chat and to allow some responses and conversations to carry on. Thank you again to our panelists, and you may leave the meeting now if you wish. Participants, again, thank you very much for being with us, and we look forward to seeing you again soon. Bye-bye, everyone.